Here is your question. Right. So if you have read and understood, considering it critical care scenario, kindly tell me how would you manage the nutritional options for this patient?
Nutrition options are there, like they're divided into two categories, parenteral and enteral.
Yes.
I can give this patient total parenteral nutrition for a
Okay.
certain period of time.
For how long?
Until the ileostomy reversal.
All right. Right after the ileostomy reversal, or you'll wait till the patient is able to eat and digest?
Yes, ma'am. I will wait for.
Until the
I will wait until the patient is stable
yes.
and ready to absorb food through enteral
What does
feeding.
it call when you hear the bowel sounds? Okay. When patient is passing gas and you can hear the bowel sounds, bowel is functional, then you can. Okay. Can you tell me why have you chosen this method?
I've chosen this method as the patient has intracutaneous fistula, iatrogenic intracutaneous fistula by defunctioning ileostomy, and
Yes.
there will be less absorption capacity by patient's gut, and there will be more loss of nutrients
Yes.
through the ileostomy output, and that's why I need to give parenteral nutrition as a support.
Right. What other methods methods of feeding do you know of?
There are other methods like enteral feeding that can be given by oral, nasogastric, nasojejunal, nasoduodenal, and for more duration, parenteral percutaneous endoscopic gastrostomy and jejunostomy. These are other options.
Parenteral nutritions are of two types. Can you tell me about them?
Yes, centrally giving parenteral nutrition and peripherally inserted by peripherally inserted central catheter.
You can say that depends because of the route of administration of the feeding. Yes. Okay.
Yes.
Can you please tell me, beside glucose, what is the highest energy source for a TPN? Total peripheral
Lipid.
nutrition. Yes, sir.
Lipid is the
Good.
second highest.
Can you tell me if you have heard of the term refeeding syndrome?
Yes, ma'am. This is a metabolic disturbance that occurs while um, uh, feeding a person after a prolonged starvation.
Okay. And what are the type of parenteral feeding options?
Non-parenteral feeding options I've mentioned. Just mentioned.
Those are oral, etc. Okay. Can you tell me what
Yes,
is the constituents of total parenteral nutrition? The component or the
constituents
constituent?
there are certain components: carbohydrate, protein, lipid. Carbohydrate should be given 50%.
Start
Then
with
lipid
water.
30%, and the rest is yes, ma'am.
You should start with water and then carbohydrates. protein, lipids,
What?
vitamins. Water is the major important.
Vitamins, minerals, and trace elements.
Okay, can you please tell me what are the indications when TPN should be given?
Indications, there are general indications like severely malnourished patient,
Yes.
For example, more than 10% weight loss within 3 to
Yes.
6 months.
Yes.
Then severely burned patient,
Yes.
multiple trauma patient,
Yes.
and severe sepsis with multi-organ failure. And
Yes.
these are the general cause. And there are certain gut-related cause like short bowel syndrome, intestinal obstruction,
Yes.
intracutaneous fistula, radiation enteritis, and inflammatory bowel disease.
How the assessment of nutritional status of a patient is made?
Nutrition assessment can be done clinically by
Yes.
anthropometric measurements and by lab tests. Clinically, we can measure patient's weight, BMI, and by anthropometric measurements like triceps fold thickness, triceps skin fold thickness, mid upper arm circumference, and by some lab tests like serum albumin, serum
Yes.
ferritin, lymphocyte counts.
So what are the signs of malnutrition that you look in a patient?
Signs of malnutrition like weight loss, more accurately, more than 10% within 3 to 6 months.
Yes.
And BMI less than 18.5.
Yes. And
kg
more
per meter
specific
square.
one, because this is a post-op patient, so you look at the poor wound healing. You look at the low albumin. Yes.
Local parameters like poor wound healing, and lab tests will reveal low hyperproteinemia, hyperalbuminemia,
Yes.
and
Hyperkalemia
full blood count,
and decreased
hyperkalemia.
cough
Full
reflex.
blood
Okay.
count will show lymphocyte count.
Can you please tell me
reduced.
what is the daily required nitrogen level in healthy and critically ill patients? What are the different?
0.3 to 6 milligram per kg.
Gram per kg.
Gram per kg.
Yes. Okay. Can you please tell me what are the sugars which are given in or which are the components of the TPN?
Dextrose.
Yes. These are made up of what, please? Short chain soluble carbohydrates and
Short chains. Yeah.
yes.
Soluble carbohydrates.
Any other thing you want to tell me about? Glucose, fructose, galactose, these are the types. Okay. Any other disaccharides which are included? Can you name any? Okay, what are the disadvantages of giving TPN to a patient for a long period of time?
For a long period of time, there are certain complications may develop, like line-related complications. For example, CV line sepsis,
Yes. Okay.
thrombophlebitis,
Yes.
thrombosis,
Yes.
and
What is the more
nutritional
common one?
complications.
Yes.
Like overfeeding. Due to overfeeding, there may be hyperglycemia, hyperammonemia, hyperlipidemia, and fluid overload. And there may be some deficiencies also, like hypoglycemia and
The most important
electrolyte
that
imbalance.
I'm sorry, I have to interrupt you. The most important that I want to hear is a bowel mucosal atrophy, because bowel mucosa, yes, bowel mucosal atrophy, because you are not using
atrophy
it.
That may lead to bacterial translocation.
That is because of what? Local hormones?
Because of lack of stimulation by tropic stimulation released in response to luminal nutrients.
Tropic release of enzymes. which are
Enzymes.
responsible for, yes, integrity of intestinal mucosa. So those are, okay. Can you please tell me, bell has gone, but we are going very slow. So if you can tell me, how would you calculate the amount of nutrition to be given to this particular patient?
For this particular patient, the total calorie requirement will be calculated first. For severely critically ill patients, 25, normally 25 to 30 kilocalorie per
Yes.
kg per day we give, but in case of critically ill patient, we can
Kilocalories per
calculate
kg. When you're telling
for
me, tell the whole, yes, figure, please.
45 to 50 kilocalorie per kg per day I will give, and this the total calorie requirement will be calculated like this, and the carbohydrate will give energy up to 4.1 kilocalorie per gram.
Yes.
Protein will give 9.1 kilocalorie per gram, and fat also 4.1 kilocalorie per gram, and by this we
Okay.
total calculation will be done.
Right.
Distribution will be done.
What other factors they influence the requirement of nutrition in a post-surgical patient or in a patient?
The post-operative
Patient, yes, and
post-operative fluid loss, or any kind of deficiency,
or because
in
of
kinds of
success, if there is advancement or if there is problem. Okay.
sorry, ma'am.
I asked you, yes, what increases or what changes the requirement of nutritional status that you'll be given? One is the patient is post-surgical, and one if there is a presence of sepsis post-operative.
Ongoing loss.
Yes. Right. One last question, please. Can you name few disadvantages of using glucose as the main source of energy for a post-operative patient?
Yes, ma'am. There are certain disadvantages, like there may be glucose intolerance, as
Yes.
these patients have the tendency to have hyperglycemia and glucose intolerance.
Yes.
And that will contribute more into it, and fatty liver
Yes.
change, derangement of liver function may occur, and
Yes.
respiratory failure may also occur.
That
Due to excess carbon
requires
dioxide
extra carbon
formation,
dioxide release. Yes, very good.
due to oxidation of glucose.
Yes. And relying solely to the glucose can lead to deficiency of? Okay, anyway, good. Thank you. Can you tell me what are you looking at, and what this arrow is pointing at?
Arrow is pointing. This is a plain X-ray
Yes.
abdomen
Yes.
view showing distended gut, distended small bowel loops in stacked coin appearance.
Stacked coin appearance, yes. Which shows maybe there is a dilatation or obstruction of small bowel.
There may be
Very
stricture due to
yes, due to
inflammatory bowel disease.
Crohn's disease, etc. Yes, very good, excellent, good, very good. Thank you.